All right. I think we can begin now. Good morning, good afternoon, and good evening, wherever you find yourself in this world. In the world, we have people still calling in, but I think we'll begin now. Thank you all so much for joining us today. We have what is going to be a good interaction session with a panel of spectacular speakers and experts in relevant disciplines to discuss the impact of lead and mercury pollution on environmental and then public health in Ghana and beyond. So my name is Blessing Enyenam Gadagu, the Technical Projects Officer for Pure Earth Ghana. As you join us today, we are hosting this webinar as part of the World Environmental Day celebration, a day that is set aside to raise awareness about our environment, to develop or discuss and develop sustainable ways of promoting the environment, as well as, All right, so without much ado, I'll call on the country director for Pure Earth Ghana to give us the welcome address. Thank you.
Good morning, good afternoon, good evening. Apologies, I'm currently on the train, so network. The network will be an issue. I hope you can hear me. I would like to welcome everyone joining us today for this crucial webinar session organized on World Environment Day. I am honored and privileged to be addressing this session. Today, we gather to share light on the pressing issue that has far-reaching consequences for both public and environmental health. The impact of lead and mercury pollution. As we stand at the intersection of environmental stewardship and public health, our commitment to a sustainable and healthy future has never been more crucial. The theme of this webinar is World Environment Day, understanding the impact of lead and mercury pollution on public and environmental health. This speaks to the very heart of our mission at Pure Earth. It calls upon us to not only recognize the severity of these pollutants, but to also take decisive action towards mitigating their effects. Lead and mercury are pervasive contaminants that jeopardize the health of millions around the globe. Exposure to these toxic metals can lead to severe and sometimes irreversible health problems, particularly affecting the most vulnerable among us, children and pregnant women. In many communities, the invisible threat of lead and mercury lingers in the air, water, soil, and even in the food we consume. This silent poison devastates developing nervous system, impairs cognitive function, and undermines the general well-being of the entire population. In Ghana, like many other parts of the world, artisanal and small-scale gold mining activities contribute significantly to mercury pollution, while the improper disposal of lead acid batteries and electronic waste exacerbate lead contamination. These activities not only pose serious health risks to the community directly involved, but also threaten the broader ecosystem, causing long-lasting environmental damage. Our gathering today represents more than just a it embodies a collective resolve to confront these challenges head-on. We are here to engage with experts, share insights, and explore innovative solutions. I believe that through our combined efforts, we can foster safer practices, enhance regulatory frameworks, and promote awareness that will drive meaningful change. As we embark on this webinar, let us be reminded that our action today will define the legacy we leave for future generations. It is within our power to to transform the toxic narrative of lead and mercury pollution into stories of resilience, recovery, and renewal. In conclusion, I would like to extend my deepest gratitude to our esteemed speakers, participants, and partners whose dedication to environmental and public health is invaluable. Together, let us mark this World Environment Day as a pivotal moment of commitment, collaboration, and concrete action. Thank you, and I look forward to engaging a productive session. Thank you all. Leslie, over to you.
All right. Thank you very much, Director, for the warm welcome address. And as we proceed, heavy metal poisoning, as you've mentioned, is a silent killer. It's often missed during environmental programming, projects, and even certain healthcare initiatives. Today, as we celebrate World Environment Day, for the next hour, we are going to discuss the impact of heavy metal pollution on public and environmental health. We will hear from our panelists on what these heavy metal pollutions are, their sources, some effects it has on us, and even real life situations that is happening around us. That's in alignment with this year's World Environment Day theme campaign that is focused on restoration, desertification, and drought resilience, under the slogan, Our Land, Our Future. Once again, my name is Blessed Enyenam Badabo, and I'm honored to moderate this webinar session and hosting such experts on the program this afternoon. All of you know the exposure of lead and mercury pollution. It has effect on multi-generation on children and the entire environment. Pure Earth is pioneering the works that is bringing out statistics studies to help moderate or to help bring solutions to solve this menace. Without much ado, I'd like to call on our first panelist, who is the Technical Director for Pure Earth Ghana. He's also a chemical engineer, an industrial hygienist specialist with master's degree in soil and environmental pollution at the University of Reading, UK. Additionally, he has certification in general industry certificates and has over 25 years experience in environmental projects around the world. Without much ado, Mr. Alfonso, the floor is yours. Thank you.
Great, thank you so much. Thank you, Esmond. Thank you to the Ghana team in Pure for this invitation. Thank you for having me here in this webinar, very important. I will share my screen. Please let me know if you can see my screen right now. Yeah, okay. Thank you so much. So, good morning, good afternoon, good evening, wherever you are. Today, I will talk about a little bit about the impact of the lead as a pollutant in the environment of basically children. Is our objective in some countries. And my idea is to present what is the impact in some countries and what are we doing to solve this kind of problem, basically. So first, I want to put the attention in one publication that we did as a Pure at UNICEF, with UNICEF some years ago, more or less 2022. And in this publication, we published the real impact of the lead as a pollutant in children, more or less. You know, the lead is a heavy metal, it's a very heavy metal component, and it's very toxic. When the lead, and maybe some of the next panelists will explain a little bit more in detail, but when the lead goes inside the body of one human, there is some effects in some organs and also in the cognitive issues for children, basically. So in this publication, you can see how much children are it's affecting. 1 of 3 children has at least one more than 5 micrograms of deciliter of lead in blood. There is no specific threshold value reference for take action. However, the World Health Organization say that up 5 micrograms to deciliter is a level that we need to put attention and need to do some interventions in when we found. So there is a critical issue. If we go to low and middle income countries, we will find that 1 of 2 children are affected with lead. In many sources, we will see what kind of sources of lead we can find. And also globally, there is 150 million people that is affected with this issue. So there is a massive problem. There is something that the politicians, governments, environmental authorities, and also the communities have to pay attention because it's a huge problem. Also, we identified the lead as the most damaged pollutant in children. And you can see the effects from the young ages, we will be fatalic for them. In terms of mortality, there is a lot of people that is dead by lead issues. The new World Bank analysis say that 5.5 millions of annual deaths we found regarding the lead concentration. Previous that data, we have 900,000 annual deaths, but to put in context, there is more than 1 million people dying annually on terms of contamination, and most of the contamination is coming from lead. And here, because the lead is not very volatile, it's more heavy than very soil compound, we can find the lead as a particulate in air pollution, especially with the contamination with the particulate that we call 2.5 combined. So when you get dust in your home, dust in the environment, maybe that kind of dust is affected with lead as well. So we can inhalate or ingesting accidentally this kind of particulates, and obviously the lead is coming inside the body, and all the effect inside the health of the people is affecting at the moment. So that's to put you in context what is happening with the lead in global. So more in detail, what are the two principal sources of contamination for lead? One is the used lead acid batteries, the lack of management, the lack of control, the lack of safe practice to recycle this kind of materials or batteries in some countries is massive. It's not only in Ghana, it's also in Indonesia, it's only in Colombia where I come from. There is many countries where this problem is huge. There is a lot of tons of lead that is processing informally, and there is producing a lot of contamination regarding with the communities near where this kind of practices is doing. So that's the principal issue with the lead batteries. But also, we can find lead in some consumer products. You can see here some products that you can find in the market normally, some cookware, aluminum or metal cookware, some ceramics as well, some toys, and species. And I will show you in one study what we did 2 years ago, that we found lead concentration in all these products. So you can have this product in your home, and we don't know if we are affecting with lead as well. So that's the two principal source of contamination from lead. Under pure air programs, we have a biggest program from 2009 called the Toxic Site Investigation Program, TSIP. And this program, the idea of this program is to collect information about what is happening in specific areas, in specific sites, and collect the most precisely information regarding with the contamination of one contaminant, in this case lead, and how many people is affected with this contaminant. In our database, we found 1,672 sites at the moment that is identified with lead contamination. That's a huge problem that we have been identified for many years. Specifically for Ghana, we have found 107 sites contaminated with lead. Most of them are located at the south of Ghana, and most of them are ULAB smelter or ULAB companies or battery companies that work recycling or producing batteries, more or less. However, we are in the task to identify if this kind of site also have any relationship with this kind of consumer product that I showed you before, because there is something regarding with the manufacture of this kind of issue. For example, paint. Paint is one of our concern in some of the products that we are analyzing. And where is the manufacture of painting, for example? There is something of these sites, maybe could be, and is some of the investigation of research we are doing already in some countries. Specifically for Ghana, we have 107 sites identified at the moment. Also, we did, I mentioned you before, maybe 2 years ago, a massive study called Rapid Market Screening, RMS, and we did this project in 25 countries, including Ghana as well. The idea of this study was to identify what kind of products in the market are contaminated with lead. It means what kind of products are commercializing, pre-commercializing, and legal commercializing that is taking effect in homes, maybe with children or maybe with us as adult. So we take a lot of samples and we found very, very, how do you say, concerned results. You can see, for example, here, what are the most high level findings by country with the color. The dark one is the highest concentration that we found in terms of percentage, and the clear one is the less one. And you can see Ghana is here. Okay. What more precisely we found in this study? For example, we analyzed more than 5,000 samples, and more of the 80% was contaminated with lead. The biggest concern for us is now the metallic cookware or metallic footwear. Basically, the cookware is coming from aluminum, is with high concentration of lead inside, and this kind of cookware maybe is using to cook food in schools or in educational institution. That is one project that we are already running in Ghana as well. Try to find the correlation between the aluminum cookware and kitchens and food preparing in educational institutions. So we expect to have some result at the end of June or at the beginning of July at least. But there is some interesting finding that we already have. However, also we found lead concentration in ceramic, paints, toys, plastic, cosmetics, or another paints like art that maybe children used to paint, some medicines, spices, sweets, and at the end also in some dry food. It's not too much in dry food, to be honest, but in general terms, we can find lead in many products that we are using day by day. Okay, this is most specific finding for Ghana. So for Ghana, you can see that is more or less the same problem. Metallic cookware, ceramic, and toys, cosmetic, is the most concern for Ghana. We are trying to start a project, a proposal with cosmetic specifically in Ghana as well. And as I mentioned before, we are doing a specific project now finding the relationship between cookware, metallic cookware, in educational institutions. This is the same information, more in percentage or graphic, that you can identify what is the problem more or less in Ghana. So there's still a problem. There is something that is concerned. So what we can do to find this kind of problems and to intervention. One of the intention for us in our projects is to do the block level assessment, the BLN. For this reason, we use basically an equipment called lead care 2, and the lead care is one device that very useful, and they allow us to do a test, blood lead test in 3 minutes, and to identify what is the lead concentration in one sample of lead. It's very useful to use this in many samples in one day in isolate areas, so we can find what is the lead concentration in children, basically. Our focus now is more in children, that is the most affecting people, that is exposure. And also to find a correlation between the lead concentration in blood and what is happening in home, we are doing a process that called home-based assessment. The idea of this home-based assessment is to identify where in home we can find maybe lead concentration. As a reference, at a rapid macular screening, we saw some items of consumer products, but the idea is to get more in deep according with the behavior and the common day of one child in a typical home. So where they play, where they sleep, or what kind of toys they use, what kind of cookware or footwear they are using daily. So we can see if there is any correlation with the lead concentration in blood and what is the item that is producing this kind of problem in the body. For example, some of the environmental sampling that we do when go home is take soil samples, paint, dust, fabric. There is a very good experience with clothes and mattresses. We found a lot of concentration of lead in one mattresses in a project in Colombia. The problem was that the children don't use shoes at all and collect all the dust in the soil on the floor and go to sleep with this dust and accumulate the lead concentration on the mattresses. So one project was change the mattresses. Also spices, there is a good study where we are doing in Asia countries that we found specifically in turmeric lead concentration in spices. Ceramics, metal cookware, toys, traditional medicine, and jewelry. And to do this, we usually do a visit in home 45 minutes with the XRF. The XRF is one device that we can use to identify heavy metals in products. So it's very useful for them and for locate this kind of lead concentration. And also we take some specific soil samples and water samples to send to the lab and to do some confirmation tests. This is the type of analysis that we already are working. This is also as an example. The triangles means the lead concentration in soil, and the red circles means the blood lead level in some children. So you can see the highest concentration of lead is related with the soil concentration in some areas. In this case, this is on a smelter located in this area of this community. There is no Ghana, there is another country, but also we try to do some correlation with socio-demographic and socioeconomic characteristics, and also with some consumer products, as I mentioned before. And again, our big concern already is aluminum cookware in educational institutions at the moment. And finally, what we need to do or what to do. First, as a government, we push the government and try to help the government to enforce the legislation and regulation as well, with more policy regarding with the lead concentration in products, lead concentration in some items. And the idea also is to create monitoring and reporting system for the country. It means frequently do some kind of surveillance and create some prevention control measure from the government to the community. More or less, is that the kind of educational program that we try to create. But obviously, as a Pure, as an organization, we also do some real intervention as a remediation issue. You can see here in the picture, we create some landfill specifically for lead, obviously with all the permission, with all the technical design, and to put a final disposal of waste, basically for lead batteries. And also we do some wash walls and also change matrices in some countries that we did in Colombia, for example. And basically, is this the kind of intervention that we do? That's the presentation that I have from today. I hope this kind of information very interesting for you. Thank you so much, and I give you the floor to you, Blessing. Thank you so much for this.
All right. Thank you very much, Alfonso. This has been a very insightful presentation. And I mean, scary to hear that 1 in 2 children are lead poisoning in low and middle income countries like Ghana. I'll be having about 900,000 death tolls annually. There are a few points I would like us to note. This session is being recorded. So with your consent, we are recording this session for future purposes. Also, there will be a session for question and answers. So during that period, we can use the question and answers tool or raise our hands with the tools on the taskbar during that session. All right. Thank you very much, Alfonso, once again. Without much ado, we move on to the next presenter, Mr. Richard Kofi Apen, Esquire. He served in various capacities at the Minerals Commission relating to project policies in mining sector in Ghana. He also served as a consultant, resource person in drafting mining and mining laws. Mr. Apen, is a key aspect in this related field, and we are here. We are happy to hear from you. We're happy to hear your powerful presentation. So, Mr. Apendo, over to you. Thank you.
Thank you very much, Blessings, for those kind words. Let me share my screen first and then we proceed. Can you see my screen, please? Is my screen visible, please?
Yes, please.
All right, okay, thanks, okay. Greetings to all those who have joined us online and to my fellow panelists. It's indeed a pleasure to be here. So without much ado, let me just proceed with the presentation. To the next slide. Right. So clearly, I'll be dealing with the topic is already known. So I'll just go straight, and I think that Alfonso had touched a little bit more on lead. So I'm not going to go much into that. But of course, we all know that it is a very soft, malleable, and heavy metal, which, when it's fresh, it is bluish white in color. But as it oxidates, it assumes a dull gray color. Geologists have been handling, ore of lead, in the field, and they know exactly how it looks like. Now, lead has found its uses mainly in the lead acid batteries, as has been said by Alfonso, and of course in radiation fields where it's used to protect, medical, radiation such as X-rays and other applications. And lead is, of course, used in manufacture of bullets. And we go to the electrical shops and we see our electricians using soldering iron, and they use lead to shoulder things, and the fumes are inhaled, and they are probably not aware of the dangers that those fumes cause. And some pipes and plumbing still have a very high amount of lead in them, and so water flows through these pipes for us to drink in our homes, and so that tells you the level of exposure that we get virtually on a daily basis. And as has been said, we all know the toxicity level of lead, which once you ingest it into the body, it affects almost every organ in the body. But because it is a metal that doesn't break down, and it affects children, their cognitive abilities, etc. And we all know that some of the paints that are used in our homes contain a very high amount of lead, and we see them also. And this lead, when they are not disposed of properly, goes into the environments and then into the soils. How and we all see, we go to the garages and we see that our auto electricians split open lead acid batteries, spill the contents in the environment. It rains and they are carried out into the soils, and it doesn't break down, and therefore it enters the food chain as well. So these are some of the critical factors that led, or critical areas that need to be looked at. And how do we contain some of these things? It's by law, and it's not just enough by passing the laws, but the key area or the key issue is how to enforce these laws. Ghana is noted for passing beautiful laws, but when it comes to enforcement, we have found wanting, and that has been our bane for decades. And like I said, this lead and mercury, they all accumulate in the environment and are taken up by living organisms, both flora and fauna. Now, I brought up this particular slide to show you the dilution, naturally occurring lead, which has value more than 11.646 ppm parts per million. That is more or less, if it were measure it in grams, it would be grams per ton. That is a very and this area is found in the untappable brown area. So you can see the dark spots there. They are areas of what elevated lead accumulation. Now, in terms of mercury, large fishes like tuna usually take them up, and then they actually remain in them. So when we eat those fish, we invariably inject some into our body as well. And we all know that all the river bodies in Ghana empty themselves into the sea. The pra, the Ofin, the cobra, they all enter into the sea. And when that happens, we all are exposed. And in some area, such as small scale mining, which is a key area where mercury is used in the amalgamation process. As we go down the line, I would show some of the efforts that are being made to contain the use of mercury in the small scale mining sector. And some dental fillings contain mercury as well. So right into our dental fillings, we are exposed. And I do believe that maybe substitutes are being found now, but to a large extent, people still walk about with dental fillings that contain mercury. So I did talk about the bioaccumulation in plants and in animals, which are taken up by plants, and then it doesn't matter whether you live in Accra or you live in the Dunkwa areas, you are still exposed, because you can never tell where that food or where that particular fruit or cassava or food that you're eating in Accra is coming from. And so you see, this is actually the geological map of Ghana. We have all the gold belts running in this direction, all the way up to the north, and then also the Laura belt. We found some lead deposits over here. Now, there was a study done by the Mining Sector Support Program, which was funded by the EU. And some samples were taken from this area and from this area. And I'll be sharing some of the results with you shortly. So, in Dunkwa, which has been heavily polluted with mercury, perhaps as a result of the state gold mining activities which involved dredging on the offing in those days that the state was managing the Dunkwa gold fields. What they did was to scoop the gold-bearing gravel, add mercury, get the gold, and then dump back the the mercury back into the environment. So you can see that this is the level of mercury that is found in the Dunkwa area. And this is kind of scary, and no effort has been done to actually remediate this as we speak. In the Obasi area, there had been some slight level of mercury elevation. Perhaps it was due to activities in some of those areas. And I saw in one of the slides from Alfonso where linings were used as for waste disposal. For us in the mining sector, we think that if you use such kind of HDPE or LLDPE or those linings, it is another pollutant that's being introduced into the environment. And so if you look at the minerals and mining laws, we had discouraged the use of linings for the tailings dams, and we think that clay which is impermeable, compacted in a certain way, would form as a layer rather than introducing another pollutant into the environment by way of lining. And what are the effects of mercury on the human beings? It affects our nervous systems, especially in children, and in adults it can lead to tremors and some cardiovascular diseases, and can affect even fertility, can result into fertility problems. Mother to fetus transmission can also occur when you inject mercury into the body, and then ultimately it can also lead to your kidney damage as well. Studies were done in the Dumasi area in the western ranges some time ago, and there were elevated levels of mercury in blood, urine, and even in the hair of samples that were taken. And for that reason, and again, of course, it also leads to immune system disorders as well. So what can be done about all this? I think we pay too much lip service to signing on to conventions in this country. We all know about the Minamata, the convention that we have signed on to, but what has been done so far? I would give a brief of what we did at the commission, trying to find an alternative to the use of mercury. And when that is done and it is commercialized, it will then call for the repeal of the Mercury Act, which is still in force. Now, when we realized that the small scale, that was in the 2000s, we realized that the small scale miners were burning the mercury openly. We had then introduced retorts where they would hit the amalgam here, and then call it the gold. They will hit it here and then call it the gold here, and then the vapor goes here. But again, it will involve the use of mercury still. So as time went on, and under the EU project, we designed a direct smelting method, which does not make use of mercury. But sad to say, this particular product, which we call Sikapuchia, is still at a stage where it has not been commercialized to the best of my knowledge. And that is what we need to do now, because it gives you a recovery of more than 90% of gold, which is better than that of what you get if you use mercury to actually amalgam the gold. And it uses very simple, chemical processes, chemicals such as soda ash and borax, which are not harmful to the environment. So before I conclude, I must say that, yes, we may have the laws, but if you do not enforce the laws, you will pay lip service to it. In 2017, 2018, there was a ban on small-scale mining in this country. But what did we say? At the time that the ban was in existence, gold production from the small-scale miners nearly doubled, when those who had the licenses to mine were stopped from carrying out the mining activities. So where did those gold come from? So trying to pay lip service to issues which are of grave concern is not the way to go. Recently, a couple of years ago, we now have a new policy called community mining. And I asked myself, what is that? What kind of animal is that? It is alien to the law. The laws are quite clear on what needs to be done and all that. But community mining, in my opinion, is fueling illegal mining activities, because people think that, hey, we live in this community, we have the power to mine and etc. And so that's why I believe we are not winning the war against illegal mining, because the communities have now, through their district assemblies, which are all political structures, have been empowered to be involved in determining or creating some kind of parallel structures to what is in existence in the law. So we need to be very careful as a country. And lead and mercury are very harmful. They don't break down in the environment. They enter the food chain. They are absorbed, and we are the ultimate, species that tend to harbor them, and it goes on to, harm us. And so we should think of the direct smelting of gold, which should be commercialized. And once that is done, the mercury law as we have it should be repealed, and disposal of waste cell batteries should strictly be, should be regulated. Nobody has the right to open up a battery. If your battery is dead, you take it to a designated place where you can swap it. If you do not bring your old battery, you cannot buy a new one. We need to enforce some of these laws so that we can ensure that we are all safe as a people. And thank you for your attention.
All right. Thank you very much, Mr. Afen, for this insightful presentation. Indeed, we are exposed to this harmful toxic metals, and then yet we are not aware. As a fellow geologist, I understand and then appreciate the characteristics of lead and mercury, how resistant they are to decay or getting lost. It just moves or transforms from one point to the other. Also, thank you very much for sharing real life situations in Ghana as fans. Thank you very much, Mr. Afen. All right, to our participants, if you have any questions, any comments, any feedback, the chat box is available for that. Any questions that you have as well, you can input that in the Q&A section, and then it will be attended to accordingly. All right, without much ado, I would call on our third presenter, Dr. Anita Asamoah. She is a senior research scientist at the Environmental Resources Research Center at the Ghana Atomic Energy Commission, and a senior lecturer and coordinator for the Nuclear and Environmental Protection Program at the School of Nuclear and Allied Sciences at the University of Ghana. She has a PhD in biotechnology, chemistry, and environmental engineering from Aalborg University in Denmark. Dr. Anita, thank you very much for joining us today, and over to you. Thank you.
Thank you, Blessing, and good morning, good afternoon, and good evening to all joining us. Please let me share my screen.
All right, as we wait on Dr. Anita.
Okay.
Questions. Okay, cheers, Fred. All right.
I'm grateful for the opportunity to be part of today's program as we mark World Environmental Day. The effect of lead and mercury is disheartening, and I'm here to also add my views on that. That's the outline of my presentation. As already said by the two previous speakers, lead is a metal, and its properties makes it applicable to be used in the automobile and electronic industries. And exposure to lead has effects on wildlife and humans. As already said, lead is used in shielding in the nuclear industry, in our electrical gadgets, even our computers and TV screens, and also in the construction industry and lead batteries. Mercury also is also a chemical, a liquid metal. Its properties being said already, so I wouldn't want to bother you much. So we will just move on to its uses. As it's used in thermometers in the scientific world, also in fluorescent lamps, and also in mining industries. Lead in industry, we use them in mining and smelting, battery manufacturing and recycling, metal processing. These are all areas that we get lead into our environment. Most of our paints, bright paints that we use, some have this lead in them. So most of our old buildings are painted with paints that contain lead. Our toys and all has lead in them. Mercury, on the other hand, is also used in industrial processes. Artisanal mining also is one of the ways, and electronic waste recycling. The used as lead acid batteries are one of the ways that we expose our environment to these metals. How are we exposed, or how are people exposed to this lead and mercury? From the industries and all, once we inhale air that has this, it gets into our system. Most of our water bodies are also polluted with lead and mercury. In the same way, our mining, our recycling, and also our landfills also contain lead and mercury substances. And once it gets into our water, it gets into the air and all. Sometimes plants take them up. So the food we eat, our tuber crops and all, can take them directly from the soil. The fish from the water, because we know they're able to bioaccumulate. So it gets into the fish. And once you are eating, you may not only be having nourishment, but doses of these poisons. What has happened in Ghana? Highlights of lead and mercury in Ghana. Research works conducted by Ghanaians have recorded appreciable levels of lead in blood, urine, nails, human nails and hair, milk, cereal baby foods. Apart from they being taken up by the cereals, sometimes locally fabricated milling machines may also be one source of lead contamination in food. Research has also shown appreciable amount of this lead also in our spices, fish, play toys. Most of the toys that come into our country, the colorful ones and even the electronic ones, have these toxic metals in them. Food crops, as already been said, food grown in illegal mining prone areas or recycling of these batteries and all, have this contaminants getting into the soil and being uptake by food crops. Our soil and sediments are also one other way. Then our water bodies, both freshwater and marine. Then our cookwares, which has also been said, is so common. Those locally manufactured cookwares in our local names as Dadisen and the aluminum cooking pots, most of them have these leads. And our ceramic bowls and pottery products for decoration or ornamental purposes are also sometimes painted with these chemicals. And these are the ways that we get exposed to them. And all these are research was done by Ghanaians. Why should we worry about lead and mercury contamination? A recent documentary by Joy FM captioned Poison for Gold elaborated on the effects of mercury and lead on Ghanaian populace. A report was made on a fetus, a postmortem performed on a dead mother and a baby, and they recorded high levels of mercury and lead in those in their fluids. So it can cause death if we don't protect ourselves from it. And research has also shown that some children in this mining areas and also recycling areas also have low IQ, and it confirms what's in literature. And also hospitals from the documentary, there was a report of a lot of organ diseases, and we can all attest to it in Ghana that there's a high rise in organ diseases like kidney, liver, and all. And blood levels of some of these patients have high level of mercury and lead in them. If we don't do anything about it, dialysis is even a problem in Ghana. How are we going to survive? Issues of restlessness and dizziness, reproductive issues, and all are as a result of these things. So we need to work at it. What can we do to save the situation? What's the legacy that we are leaving for future generations? We need to research and research and research. We need to keep on studying, investigating to know how this lead and mercury change or migrate in the environment, the effect on humans and all, so that we will come out with the possible solutions. After we've been able to know more on these contaminants, we need to have a stakeholder engagement to the people that matter to take up decisions, not just word of mouth, but actions also to be able to curb the situation. There should be public education, just like we are doing today. It shouldn't be just that. We should keep on educating the public about the dangers of these metals so that they will take their own safety into their hands and protect themselves. Aside that, we need to train these waste recyclers every now and then so that they will do the right thing. And there should be screening of paint and play toys and other electronic gadgets that come into our environment or into Ghana. And we've already signed a lot of laws. What is left is for us to enforce the laws and make sure that the laws are working. And above all, or aside what have already been mentioned, once we have researched and identified those contaminated sites and all, we should find a way of cleaning up our environment and making it a better place for the future generation. Contaminants don't respect anyone's. Lead and mercury don't respect anyone. It can get to anyone, no matter how rich, poor, or your stance in society. So it is everyone's business. Let's all come together and save our environment. Thank you.
All right. Thank you very much, Dr. Anita, for this informative presentation. You've shed light on the treacherous and the dire consequences of lead and mercury pollution, some of the ways we contract them, and then what next steps that need to be taken to help curb this menace in Ghana and probably beyond. Thank you very much. At this point, I'm going to open the floor for those with questions. The Q&A section is also open. Any comments, contribution, questions that you have, let us receive them in the Q&A section. All right. Okay, any question? We've heard about some of the sources of lead pollution, some of which are right in our homes, starting from the leaded paints to the pots we used in cooking, to our leaded pipes, and so on and so forth. What questions do we have for our experts on the panel today?
I think someone is asking, with regards to contaminated sites that have been observed, are there any remediation initiatives being implemented in Ghana by any stakeholder, whether NGOs or the government?
All right, thank you very much, Saki. All right, so this question goes for any of our panelists. Any of the contaminated sites that have been observed in Ghana, whether any remediation initiative has been implemented by Ghana, either our NGOs or stakeholders or governments.
Can I just make a few comments or maybe try to answer part of that question? When we did the EU project on the mining sector, which was, entitled the Mining Sector Support Program, and it was one of the, detailed work that we carried out in the country to determine, polluted sites And that was how come we knew the level of mercury and lead that was in some area, because we did regional geochemical analysis of some of these areas. And as part of the program, there were a series of projects which we had to carry out. We had a pilot, remediation plan, embedded in that particular, that we didn't have the funds to do a kind of a wholesale, remediation or cleanup. So the program, in trying to design the program, we had an input that had to do with pilot, remediation. So we take one of the contaminated sites and we will carry out a pilot remediation, which will serve as a blueprint, where in the future we could carry out a wholesale, remediation. But unfortunately, that didn't happen. It didn't happen because this was an EU grant, not a loan grant to the government of Ghana. We had a back and forth on it because the consultant or the donors wanted to have a wholesale, foreign entities coming to carry out the pilot remediation plan. And we were of the opinion that, look, if they did that, there would not be any expertise or any training of people that would be trained, Ghanaian experts or maybe Ghanaians who will be trained on this particular task. And so we had proposed to them that we need a blend of the expatriates and local experts who would learn, so that when the project comes to an end, we would have built local capacity to take over and replicate some of these things elsewhere. And that's where we hit the crossroad, because we stood our ground and they said that we're not going to just allow them to come from wherever come. The money goes back to them, and we don't build local capacity. And so sadly, nothing was done. And so I don't know, since I left the commission, I don't know whether they've taken it up, but I don't think that has been done.
Okay, thank you very much, Mr. Apenu. I agree with your stance, or the stance of the people then who were taking that initiative. Once people are coming to do something like this, of course, at the end of the day or at the end of the project, there should be Ghanaians or agencies or group of people who could be able to carry out that project. It's unfortunate it didn't happen, but we hope to see more of that. We hope to see something like that happen in Ghana. I would also want to add that Pure Ghana has also carried out a risk mitigation at a lead contaminated site at the Tema industrial area. So that's one of the remediation activities Pure has covered. It was on a lead contaminated site. All right. I think we have a hand up. Abbas Gabriela, please, the floor is yours.
Thank you very much. Good afternoon, everybody. I wanted to find out from Mr. Apenu. Please, during the mining sector support program, when you were doing the analysis, especially to looking at the mercury contamination, were you able to discriminate or quantify the percentage of this contamination that is as a result of the illegal mining activities, or it was just a lump sum project that we just identified the mercury concentrations? Thank you.
All right, thank you very much, Abbas. Dr. Apenu, over to you.
Well, I am yet to get my PhD, so I am still Mr. Well, prior to identifying the hotspots, we call them the hotspots in the country. So it was not only one side. In fact, we tried to map up where the hotspots were. Some of them may fall into some small scale or illegal mining activities, but it will be difficult to that the way these illegal operators work, they hit and run and keep moving from place to place. But we identified areas where we call the hotspots, and then that has been documented. But it was done when we were going to go to the next phase. that's when we hit a snag because we stood our grounds and said, look, we wanted to have build local, capacity. So yes, in some of the areas may cover, areas where we have, illegal operators or which they had mined in the past. Yeah. I hope I've been able to answer your question.
I hope so too.
Yes, please. Yes, please. Thank you very much. I was more
Thank
happy, especially because my question was whether we could be able to stop the illegal mining. But at least your project was able to provide an alternative to this use of mercury to be able to do the recovery of gold. So I'm satisfied. Thank you very much.
Yeah, yes. Actually, you see that, that particular project, we call it the Mercury Abatement Project. And what we did was that it was a teamwork where we insisted that, look, we need to have it involved the British Geological Survey and UMAT. And so as I speak now, we've built local capacity in that field. And as at the time I was there, we were trying to see how we can move it from the prototype stage into a commercial, phase. Because one, we did tests around in the small scale mining areas, and it was widely accepted because the recovery was excellent, better than what they were getting when actually they were using mercury. So once actually the recovery was excellent, the next thing will be the cost. And when we did, I think we did about 30 something prototypes, which we gave out to the various small scale miners as associations as means of trying to sensitize them and all that. But at the time, the cost per unit was a bit on the high side. But once it is commercialized and produced on a mass scale, the unit price would drop and would be affordable to the miners. So, and if we're able to do that, then there's no reason why we should have the PNS law 217 on our statute books. It will be of no value or of no importance because we have a direct smelting method, which does not make use of mercury, have a higher recovery. So why do you have a mercury law still on our table? Then we can call for the repeal of that law, and then we will be seen to be complying with the Minamata convention. I took a trip to one of these African countries. I wouldn't want to mention the name, but they have been able to prevent the this influx of what do you call it foreign Asian galamseyers who carry out mining without due process of that regard to the law and all that. And in that country, they don't use mercury. I mean, in fact, small scale gold mining is not even allowed. But that is also being far-fetched, because if there's a demand for something and you don't properly regulate it, people find a way of doing it on your blind side. So we are trying to draft a policy for them, trying to let them understand how they need to open up and then properly to regulate the sector so it could serve as an employment for the people as well. So that is what. So I mean, we need to move it from the prototype stage into the commercial phase. And once that is done, repeal 217, PNS law 217, i.e. the Mercury Act, and that's it. And then we are being seen to be complying with the Minamata Convention that mercury is outlawed in Ghana. Thank you.
All right. Thank you very much, Mr. Penny, for the insightful answers to this question. All right. Next on the floor, we have Samantha. Samantha, the floor is yours.
Okay, thank you very much, Blessing. So my question is directed to all panelists. It's mostly centered around community engagement. So I think I'll direct the first question to Mr. Rodriguez. He mentioned that in the presentation that there was an element of community engagement whereby the population was encouraged to watch the walls, watch the flows, and continuously change their matrices. I want to know the strategies that they implemented in ensuring that the community was on board and that they participated in these activities. And then to Dr. Anita and Mr. Fenu, to Mr. Fenu, with your previous project that was led and Mercury focused, was there an element of community engagement? Was there an element of you involving the community in any of the project's implementation strategies? If so, how did you do that? How did you bring them on board? And then to Dr. Anita, has the Ghana Atomic Energy Commission done any public health related education programs? If so, in which areas have you targeted these educational programs and how was the response? And I think there's also, I put a question in the Q&A for Mr. Fenu with regards to getting stakeholders on board and avoiding them working in silos, because it looks like this problem is something that needs all stakeholders to unite and not just work in their various areas alone, and limiting the success of the intervention strategies that various organizations might be implementing on the ground. Thank you.
All right, thank you very much, Samantha. So we'll go first with the question to Rodriguez. Washing of walls and in communities, how was this implemented? Mr. Alfonso.
Okay, Samantha, thank you so much for the question. And okay, this is very good question. In order to engage the community in this kind of project, we need to work directly first with the local authorities, it means the health authorities and environmental authorities as well in the local area, it means the regional or of the town, and also the community leaders. This is very important to engage the community leaders, because obviously the community, they don't know what is happening with the problem. So we need to do a educational program first. What is the problem to them? What is the context of the issue? And then when they understand everything, we can enter to do the interventions. Before to do that, it's very complicated because they should know what is happening, what is the problem, what is the impact, and what they have to do. So first is a educational program with the community, it's a campaign, many workshops and trainings as well for kids and adults. For example, we did in Colombia a small party for children in lead and mercury contamination and some play games for table games for children, and they understand the problem. And then we start doing the intervention. Wash the floor, wash the walls as well, and also change how to clean the clothes and keep the mattresses clean as well. So to go into the home is not easy, it's a process. So you need to engage a lot of people, stakeholders, but the idea is to be a holistic and comprehensive project at the end. I hope answered your question properly.
Thank you very much, Alfonso.
Yes, thank you.
All right, thank you, Samantha. Before I move to Mr. Femi's question, Dr. Anita, can you please answer the question concerning Ghana Atomic Energy's any public health education that has been carried out, and if so, where?
Thank you very much, Samantha. We've done a lot on them. Ghana Atomic Energy is a research institution. So normally we conduct research and our findings are published in peer-reviewed journals. And we also engage the public through public lectures like this. And also on the shoulders of Ghana Science, we have airtime on radio stations to talk about our works like this. And also through international media. I did a work on organic pollutants at Agbogloshi e-waste site, and that work was we carried out a public program for people to know our findings through a Joy FM documentary, even BBC and CBS News in US. So we are doing a lot on that. Thank you.
All right, thank you very much, Dr. Anita. Samantha, I believe this answers that question.
Yes, thank you.
Thank you very much. Moving on to the question for Mr. Fen. Any community engagement in your lead and mercury projects? That's one. And then the next question is with regards to implementing remediation strategies and enforcing laws, how can we ensure that all stakeholders are not working in silos, but rather they unite in ensuring the success of these intervention strategies? Over to you, Mr. Fen.
Thank you very much. I do not think by maybe our training you can meaningfully carry out any successful field work without community engagement. In fact, the community people may not even allow you to even be successful in your work. And so, I mean, you actually as a geologist, I mean, you can, there are ways that you need to. There are certain protocols you need to follow through if I know how to engage the community and to make sure that you have that they have your buy-in and let them know that all what has been done, it's in the interest of the community as well. So yes, there was that massive community engagement. In fact, I'll just say even one. There was a time that we were doing exploration in the Boom volcanics. That's the Nkwanta, from the Nkwanta down to Hwakwe block, and the team of private geologists that went to the field had didn't go through the proper community engagement, and then they had a challenge. I had to organize a deba of chiefs and people went around to, and then we held a meeting, and we needed to educate them, and they brought their own reps to be part of the exploration thing. So we are very much, or we were very much, conscious of that. I will just share one of the forms. Let me share my screen, which shows one of the forms from what do you call it? I'm sure you can see it, right? So you can see this from Tunkwa, and this was what we did there. So you can see the list of people who were contacted. You can see that, and these are only their leaders. We couldn't contact each and every group members, but we worked through the leaders, and then we had to have debats and then focus group discussions with them. So we had lots of these forms for each of the areas which were visited, and so that has been, or that was done. And how do you bring them on board? Yes, like I said, I mean, you just cannot do effective projects in the field if you don't have the support of the community as a whole. I have crisscrossed this country, held workshops, even to educate them on the new regulations that were passed in 2012, and also the mining policy, for example. And so that's something that you will be making a great mistake if you skip that particular phase of the community engagement in whatever you want to do in the community. Thank you.
All right. Thank you very much, Mr. Apen. Samantha, I believe this answers your question.
Yes, thank you.
All right. Thank you very much. Next on the floor, Emmanuel Atiobi. The floor is open for you to ask a question.
Yes, thank you very much. Yeah, I want to thank the three panelists for their very informative presentations. So my question, I believe, has more of an academic than practical relevance, because I want to inquire to, and this question is to any of the panelists, about the residence time of some of these heavy metals, specifically within the soil. So I want to know if there's some variability with respect to maybe the specific soil type or geology of the region that can influence the amount of time these heavy metals can remain in those areas and not sort of dissipate or spread out into um, other places or zones.
As far as I know, once they get into the environment, they remain in the environment for forever, unless they can be taken up by plants into the food chain, etc. But they do not break down, unlike cyanide, for example, where when the cyanide is exposed to the sunlight, it breaks down. But for mercury and lead, as far as I know, I may be wrong, but as far as I know, they remain in the environment forever. Maybe unless any of the panelists have a contrary view.
No other view. I think what Mr. Feno said is right. They are very persistent in the environment, and they are being taken up by plant roots, or even but they have the ability to accumulate and bioaccumulate in aquatic organisms and still end up in other organisms to continue their business. If you take in fish that has them, it's still the lead, it's still the mercury, it gets into your system. Thank you very much.
Thank you, please. I would like to ask a follow-up question. So please, as you said, like I want to try and find out if there are possible ways that with a given ample amount of time, the environment can itself, probably through some geochemical processes, like rid itself of some concentrations of some of these heavy metals, like given some ample time in the environment.
All right, thank you very much, Emmanuel. And to any of the panelists.
Hi, Blessing. Maybe if I understand well, the question is the limit values of reference of each metal in the environment is the question. I don't know too much about the Ghana regulation, but I will talk more about the international reference. So, for example, in lead, last year, the limit value for residential soil in lead was 400 ppm. However, the EPA in the US changed this value to 200 ppm. So they reduced the half of the limit value. So every single time is reducing more. So now is for residential soil, the limit value 200 ppm is the near value. So in terms of lead in products, we talk about cookware 100 ppm, and for painting and other products 90 ppm in terms of value reference. In order to talk about mercury, there is a quite different because the chemical is very, very different. And there is no real value for example, a big problem in mining regarding with tailings, contaminated tailings from artisanal gold mining. According with the Minamata Convention, there is no a limit value now. There is the technical committee where I used to participate. There is no a final decision. However, some experts and some people take 11 ppm as the limit value as a reference, also as a soil for residential areas as a limit value to work with the soil limits in Mercury. So 11 ppm is one of the limits values. Some people talk about 10, 5 ppm, but the legal value in the US at least is 11 ppm of concentration of mercury for residential soil. That's some of the reference that we work in our project. So I hope this answered your question.
Right.
Also, to add up, we have isotopes of lead, and lead 205 is the most stable radioisotope. When we say stable, it means that it doesn't degrade easily. And the second isotope, which is lead 205, is also very stable with a half-life of about 52,500 years. So you can see that it can really stay long in the environment. Thank you very much.
All right. Thank you very much, Dr. Anita. Emmanuel, I believe your question is answered.
Yes, yes, very well. Thank you all to the panelists for the answers. Thank you.
All right. We have another question, another person. Okay, Thomas Na. The floor is open. You can unmute and ask your question.
Thank you so much. And thank you to panelists for the insightful presentations. My concern has to do with dam sites. And a lot of dam sites are coming up all over the country. So from the time the research was done till now, many dam sites which are possibly contaminated sites. So I would like to know how can we deploy some volunteers all over the country so that we can collect more data and know the real state of the contamination in Ghana. I believe we can also work with student volunteer researchers like those in MSc or PhD, if we can sell the ideas to the various faculties so that they on their own will volunteer and collect the information, and we can have a concrete data to make our case to the international community. Thank you.
All right. Thank you very much, Thomas. I believe this is to our academicians, Dr. Anita Samoa.
Yes, I think that there's a lot to be done. As I said at my conclusion part, that research. We need to continue with that. The issue with our landfill sites and our waste collection in Ghana is that we lump them up together. We don't have waste segregation. So separating even metallic waste from organic waste and other things are a problem. So we need to even start from there and also continue with research, engage more master students, PhD, and even undergrads to come out with data to be able to solve our problem. Thank you very much.
Okay. Thank you very much, Doc. Believe we have another question. Mike Anane, the floor is open. Mike Anane, kindly unmute yourself and ask your question. Okay, whilst we don't hear from you, his question is in the Q&A session. He's asking, can producers be sued for legal exposure or poisoning? do manufacturers have any legal obligations in this direction? Okay, to any of our panelists.
Blessing, I'm not able to see the questions, so I don't know. The question, maybe I don't have the rights to see the questions because I've not seen anything apart from what that Saki sent earlier. That's all that I can see. So
Okay,
if you
it's
could
in a-
forward the question. Okay. I can see the questions in the chat.
Sorry,
The chat
it's
box.
a Q&A session.
Oh, let me see. Q&A.
Yeah.
Yeah, okay, all right, okay, great, all right, okay, sure,
So,
okay, all right,
Blessing,
okay, I have seen.
if I may come in, then Mr. Fenu, the legal man, will add his point to it. I know of the polluter pays principle, that when you pollute or you contaminate, you have to pay something or you have to rectify whatever you have contaminated. But as to how these laws are enforced is another challenge. So probably he's in the legal session. I know that you can't just contaminate and go scot-free. You need to pay or correct whatever you have done. But the law, are we enforcing it? Are people put to tax on whatever they have to do? That is another issue. So maybe Mr. Fenu will tell us on
yeah.
the legal side.
Right. Thank you very much. But the question is very, specific. Can producers be sued for lead exposure or poisoning? Do manufacturers have any legal obligations in these directions? Now, the question is referring to those who manufacture these products. All right. Now, if I manufacture a product, some of these products would have labels on them clearly. And so these labels to tell you what they contain. Now, if, for example, somebody in his application was reckless or didn't, was not, reckless in his application, and therefore, as a result, is exposed to some harm, he may sue, but the question is, that notice that had been placed on the label is actually a disclaimer. And so if you have been, reckless and in this application, I don't think that your action would succeed. It's just like those who manufacture medicines, that we buy under this thing. If you go and buy, paracetamol or any other medication, and they say take it 1-2 times a day, and you decide to inject far more than required, the question is, can you bring an action against the manufacturer? You may, but your chances of succeeding in court will be very minimal. And so, unless there's a direct, causal link from the person to who has suffered a harm, there's a direct causal link. I am afraid your action may not succeed. But if there's a direct causal link from the person, I gave it and I gave it to you in a way, and then you use it in the way I say you should use it, and you suffer a harm, then you can bring an action against me. I hope I am clear. Thanks.
Thank you very much, Mr. Fedo, for answering this question. And to all, I think we are exceeding our time a bit. So at this juncture, if you have any further questions, any further inquiries or comments, kindly send them to our organizers. And also, we have our social media handles and websites in the chat section. So you can kindly reach out and then get more resources on the presentations we've made today. All right. We have a few key takeaways. We have a lot actually, but then to highlight on a few, we've discovered a lot of sources of lead and mercury contamination around us, very close to us. And then we've been educated on some of the effects of these lead and mercury poisoning. Also, we have issues about enforcement here and there. So call to action. We would call on all government agencies, all relevant stakeholders to help. Also to help in various and diverse ways they can to help cure or reduce or eradicate this menace from our society. We also call on key stakeholders to unite in working against this common enemy, that's the lead and mercury pollution. At this juncture, I'll call on our country director to give a brief closing remark as we wrap up. All right, Esmond, over to you.
Right, thank you very much, Blessing. I would like to use this opportunity to thank our esteemed panelists, Dr. Anita, Mr. Apenu Esquire, and Alfonso, our own colleague. It's been very insightful discussion. A lot of questions and have been addressed through your presentations. And also want to thank the panelists, the participants for joining in this insightful discussion. For us, this is just the beginning of the road. A lot needs to be done to protect our environment. We believe a lot can be done in all ways to ensure that lives are safe, the planet is protected, and above all, the environment that we live in is able to sustain us. So thank you very much. I can't thank you enough. And to my colleagues, it's amazing putting together this great presentation. Keep the good work up, and I'm sure posterity will be the best judge. Thank you very much, and have a blessed day.
Thank you very much, Director. At this juncture, I also want to thank everybody, all participants, our panelists, for your contributions and commitment in protecting public and environmental health. To everybody, as we go, let us all do our bit in getting or in solving lead and mercury pollution and then environmental pollution as a whole. Thank you very much, and then have a good day.